Hello viewers, welcome to our Facebook live session. Today we'll be discussing on migraine and we have with us our expert Dr. Vishal Chafale, consultant interventional neurologist at Apollo Hospitals, Navi Mumbai. The first question is, what is migraine? Can you explain?
Hello. Migraine is one of the common type of headache. It is characterized by recurrent and often severe types of headache associated with various neurological and sensory signs and symptoms.
What are the symptoms of migraine?
Headache is a common symptom of migraine. Migraine headache is generally unilateral. It can be bilateral or it can be sometimes localized to particular part of the brain like behind the eye. It can be localized to the top of the head or base of the head. Patient describe headache as a pulsatile, throbbing type of pain and often severe, which builds up over minutes and to few hours. It lasts for few hours and sometimes in some patient it can last for several days. It is generally episodic pain, means 1 or 2 times in a week or 1 or 2 times in a month. Sometimes in some patient in chronic migraine it can be daily headache also. Some patients experience a warning sign, we call it aura, before the onset of headache. Auras are mostly visual in case of migraine. About 1/3 of the patient of migraine experience such visual auras before the onset of the headache. They describe it as a blurring of vision. We start in the corner of the angle of the eye and in the form of zigzag lines, and it's after few minutes or few hours it is followed by the headache. Sometimes aura can be a sensory like tingling, numbness. Sometimes patient develop abnormal sensitivity in light and noise before the onset of headache. Along with headache, patient develop most of the patients of migraine develop feeling of vomiting. We call it nausea. Sometimes actual vomiting. Patient develop intolerance to the light, we call it photophobia. Some patient develop sensitivity to loud sounds, we call it phonophobia. Sometimes patient feel dizziness or vertigo. It is more common in vestibular migraine variant of the migraine. So migraine can have lot of symptoms along with headache. Most of these symptoms are severe enough to impair day-to-day activity. So that's why migraine attack can be a disabling in some patients.
What are the conditions which precipitates migraine?
Common precipitants of migraine are stress, any form of stress, physical or emotional stress, change in routine. So that's why migraine attacks are more common in weekends. Then strong smell, strong odor, bright light, some food and beverages like processed food, cheese, alcohol, excessive tea, excessive coffee in some patients. In females, migraine attacks are more common during menstrual cycle because there is hormonal change, so we call it menstrual migraine. Then irregular food habit, lack of physical activity, these are all common precipitants of the migraine attack.
How migraine is different from a regular type of headache? Can you explain?
As I mentioned, migraine is common type of headache, but apart from migraine, there are other headaches which are also common, like in tension type of headache. In tension type of headache, patient develop constricting, nagging pain, which is not associated with vomiting or light sensitivity or noise sensitivity like in migraine. In sinus headache, a patient have sinusitis, have running nose, allergies, and there is seasonal variation and there is a localized pain over sinuses. So this is how we can differentiate. But there are certain red flag signs when we should consult a doctor to rule out other underlying cause causing headache, like changing character of headache, like when headache is out of proportion, which is very, very severe. Then associated neurological deficits like patient is having double vision, weakness of any limb along with headache, then fever, elderly with a new onset type of headache, or any new onset headache in anybody needs some consultation to rule out any secondary cause which is causing headache.
So are there any treatments for headache?
Migraine is a condition, it is not a disease. So aim of the treatment is to control headache. As it is not disease, so cure, we don't expect cure in a migraine. It will resolve with age. So we can avoid the migraine attack by avoiding its precipitants, like maintain your daily schedule, avoid fasting, avoid food or avoid conditions which precipitate headache. Then physical activity is recommended in patients with migraine. 30 minutes of any physical activity daily can prevent significantly the migraine attacks. Then there are 2 types of medicines in migraine treatment. First of all, to control the headache. Whenever there is acute headache, we can give some medicines to control headache, and there are some medicine to prevent headache. So any analgesic, commonly used analgesic can be used to control headache. Commonly used medicines are paracetamol or naproxen. But here patient, you should not wait for headache to establish, because once headache is established, then you have to take multiple medicines and headache may last longer. So whenever they get any warning sign of headache, you should take medicine at that time, so that minimal dose of medicine will work. In some patient, this medicine may not work, this medicine may not work, then you have to take a repeat dose after a few hours. But in some patients still headache remains, then next step is a triptans. These are the group of medicines which are available in oral formulation, rapid disintegrating form, and also nasal formulation. So this can be used in some patients. And some patient, despite all these measures, headache continues, there is vomiting, then we have to give injectables. So such patient may need hospitalization also. Then if headache frequency is quite frequent, headache is quite frequent, then we need some medicines to prevent headache also. The commonly used medicines to prevent headache are amitriptyline, then some antiepileptics like topiramate, then valproate, then beta blockers like propranolol, then flunarizine. These are the common medicines for migraine attacks, especially when the headaches are quite frequent. So migraine is one of the treatable and controllable headaches. Headaches are often disabling and it can cause a workday loss, but it is treatable and preventable. You should consult your doctor for its better treatment. Thank you.
Thank you, doctor, for joining this session.